I'm Dr. Neil Park, Director of Clinical Affairs for Glidewell Laboratories, and we're here in San Diego at the annual meeting of the Academy of Osseointegration. Our guest today is Dr. Daniel Galindo. Dr. Galindo is a prosthodontist in practice in Phoenix, Arizona. He is a recognized leader in the field of implant dentistry and is a frequent lecturer and author. Welcome, Daniel. Thanks for spending some time with us today.
Thanks, Neil. Thanks for the invitation.
Absolutely. Could you maybe give us some background, tell us a little bit about yourself, where you grew up, and how you decided to enter the field of dentistry?
So I grew up in Bogota, Colombia, and my dad's a dentist, so I grew up seeing what he did, and I would spend my summers at his office playing with stone, pouring models, pouring impressions, and it just fascinated me since I was 12, 13 years old. So I kind of grew into it. I knew from a very early age that I wanted to be a dentist, and that's how it came about.
That's great. And how about prosthodontics? How did you decide on the specialty?
You know, while I was in dental school, I was attracted to prosthodontics because of the involvement of my professors in the field. And I had a skill for working with the wax and acrylic, and it brought me into it. By the time I finished dental school, I thought I wanted to be a prosthodontist. I practiced general dentistry for 4 years, and eventually it came to that.
Okay, and that's what brought you to the U.S. to do your specialty
training?
training?
I moved in 1996 to Rochester, New York, and that's where I did my pros residency.
And a few years ago you joined ClearChoice. What made you join that type of highly specialized prosthodontic practice?
You know, ClearChoice was coming to Phoenix, in 2007 I was approached by them. The idea of an individualized center where we could provide services to patients was appealing to me, so that we can provide the type of treatments that implant dentistry allows us to provide in a single setting without having the patients bouncing from one place to another. So that was the main appeal.
Right. And clearly the model has been very successful. Could you tell our viewers a little bit about the profile of the kind of patient that seeks treatment at ClearChoice?
There's different types of patients, from the person that's missing 1 or 2 teeth to the person that is either already missing all of their teeth or they know that they're going to lose all of them. So it's a broad range of services. We focus mostly on the full mouth reconstruction with implant.
Has the treatment protocols at ClearChoice changed over the years?
It's changed in the sense that we are learning of new materials that we can incorporate for the benefit of our patients. The essence is the same, but we've been progressing along as the dental industry has been progressing with new materials, newer technologies.
Right. So I'm aware that you've been doing some of the Bruxer full arch monolithic zirconium bridges.
Yeah.
What's your experience been with those bridges, and what led you to decide to try them?
You know, it's been a great experience. Traditionally, we had reconstructed the edentulous patient with a hybrid prosthesis. It's similar to what we were doing before with gold crowns, but things have evolved. There's new materials, there's new technologies available that provide a longer lasting result for patients to enjoy. So Bruxism came as something that I really wanted to embrace and incorporate into my practice.
And how have your patients accepted this new option that you're offering them?
You know, they love it. They love it. They like the looks, they like the fit, they like the comfort. I personally love it because of the durability it provides them.
Right. As you know, I spent some time working with ClearChoice, and that was one of the things that I noticed was after a few years, there started to be repairs that were needed. And of course, patients have paid a lot of money for this very high level of treatment, and they're not happy about having to go and have repairs.
Well, acrylic unavoidably will deteriorate. It will either wear down, or it can chip, or it can fracture. It's just like the acrylic facings on gold crowns many decades ago. It will happen. So now that we have different materials available that have been tested, because Glidewell has done incredible testing on these materials, then we can incorporate them into practice.
Of course, Daniel, ClearChoice is known for the full arch immediate function treatment, but do you do other forms of treatment in your practice?
Yeah, absolutely. At the office, we restore single, multiple implants, anterior, posterior teeth. Again, we want to replace teeth that have been missing or teeth that are lost with dental implants, which is the most natural way to do it for patients. And in those cases, We're using either Bruxism crowns in the posterior teeth or 3-unit fixed partial dentures, as well as highly aesthetic ones with the prismatic type reconstruction with layered
And do you tend to go with the screw-retained monolithic crowns, or are you doing crowns cemented over custom abutments? What's your method?
I'd like to keep it simple. So whenever I can do screw retained, that is my choice. We know from the literature, we know from the presentations that if we can avoid that possible cement that can leak and hide itself behind the restoration when we're taking the x-rays, that will eventually lead to either soft tissue or bone complications, I prefer to avoid that. Okay. So if possible, I'll do screw retained. There's some instances where we'll do cement retained, and following the protocols of making sure that there is no excess cement and that it is removed appropriately.
Here at the Academy of Osseointegration, there's so much conversation and so many lectures about guided surgery. What's your experience and your feeling about the usefulness and the importance of guided surgery?
It has its indications. We've used guided surgery for the replacement of single teeth, for the replacement of multiple teeth, and for full mouth replacements. I think that there is a place for it. As that digital path evolves and it allows us to take it not only from the diagnostic and the surgical stage, but also to the restorative, I think it's going to fall into place, and that's one of the things that I look forward to as part of my practicing career.
Right. That's interesting. Yeah, we're certainly in the development phase. And staying on the topic of digital dentistry, of course, the availability of digital impressions is another topic that's discussed frequently. But we know from statistics at our laboratory that it's a really small percentage of cases come in digitally. Do you feel like that technology is ready, or have we not yet hit the tipping point?
I think it hasn't hit the tipping point, but I hope that moment comes soon. It will certainly simplify a number of procedures for the patient and for the treating dentist. I look forward to the day where I can restore a full arch reconstruction with 4 implants by taking a digital impression. And furthermore, being able to scan that prosthesis that I have made for the patient without needing to send it into the lab, so that the turnover will be faster and the inconvenience for the patient will be less.
Exactly. So what trends do you see coming up? What do you think we'll be doing in the next 5 or 10 years that'll be very different from what we're doing right now?
Digital. It all comes down to digital. Again, being able to streamline that process for patients and minimize the downtime, minimize the fabrication time so that we can get results. We're in the era of immediate satisfaction. So the less somebody has to wait for things, the happier they will be.
That's right.
And that applies for the dentist as well.
You know, and as you walk through our laboratory, and a few years ago it was Bunsen burners and torches, and now it's all computer screens and keyboards. So things have changed, and I think that pace of acceleration is.
Oh, it's very exciting.
That's
great.
It's
very exciting.
Great.
Yeah.
Well, Daniel, thanks so much for spending some time with us. We really appreciate the opportunity to speak with you, and we'll do it again soon.
Neil, thanks for the invitation. I appreciate it.
Right.
Thank you.